Why do two communities who pray alike treat sickness so differently? The Amish and Mennonites share common religious roots, yet their approaches to healthcare couldn't be more opposite. The Amish rely on natural remedies and avoid hospitals, while Mennonites embrace modern medicine, work in healthcare, and have pioneered mental health services. From homemade salves to psychiatric hospitals, these two faith-driven communities walk vastly different paths when it comes to healing the body and mind. In this video, we'll explore how two faith-driven groups walk very different paths when it comes to healing the body and mind. And don't forget to subscribe for more deep dives into faith and tradition. A combination of spiritual beliefs, cultural practices, financial constraints, and a profound emphasis on simplicity shapes the Amish approach to healthcare. Although they are not entirely opposed to modern medicine or hospital care, the Amish generally prefer natural and traditional healing methods. When a medical issue becomes critical, they do seek professional help, but their first response is often centered on home remedies, prayer, and community care. A central part of Amish healthcare is the use of complementary and alternative medicine, such as herbal remedies, essential oils, massage, chiropractic care, and folk healing by brauchers. These natural methods align with their values of simplicity and modesty and are viewed as gentler than hospital treatments. Their approach is deeply rooted in faith, with illness often seen as part of God's plan or a spiritual test. As a result, they are cautious about aggressive medical interventions, turning first to prayer, patience, and natural remedies. Healthcare decisions are usually made collectively, involving family, church elders, and community input, rather than relying solely on doctors. This reflects the Amish belief in spiritual guidance and community over institutional healthcare, reinforcing their preference for natural healing and minimal reliance on modern medicine unless absolutely necessary. The Amish often view hospitals as part of the English world, places filled with technology and unfamiliar routines that don't align with their values of modesty, humility, and community care. While not completely against hospital use, they prefer simple, local solutions. Practical barriers also discourage hospital visits. Since most Amish do not drive, reaching distant hospitals requires hiring a non-Amish driver, adding cost and difficulty. With limited access to phones and internet, managing medical appointments and emergencies becomes challenging. These cultural beliefs and logistical issues lead many Amish to rely on home-based care supported by family and church members. This approach reflects their emphasis on mutual aid, spiritual values, and maintaining distance from modern influences. For the Amish, healthcare costs are a significant concern, especially since most do not carry traditional health insurance or participate in Medicare or Medicaid. Exempt from federal healthcare laws, they rely on community-funded solutions. Local churches often maintain alms funds, contributed by members, to support families facing major medical expenses. In some wealthier communities, families join Amish Hospital Aid, a non-profit program where members pay a monthly fee and the organization helps negotiate and cover hospital bills. This system balances responsibility, avoids overburdening church funds, and preserves fairness. To minimize costs, Amish individuals often shop for affordable treatments, including traveling to Tijuana, Mexico for cheaper surgeries or dental care. Some clinics even target Amish communities with tailored services. This practical, community-centered approach reflects their values of self-reliance and mutual aid in health-related matters. Home-based care is at the heart of Amish healthcare. When someone is sick or elderly, family, neighbors, and church members step in to help, reflecting their strong belief in mutual aid, caring for one another without depending on external institutions. This approach not only provides emotional comfort, but also upholds Amish values like humility, service, and community. Their lifestyle further supports good health. The Amish eat mostly homegrown, unprocessed foods, engage in regular physical labor, and live without constant digital distractions, reducing stress and promoting mental well-being. Studies show Amish children have lower rates of allergies and asthma thanks to early exposure to farm life, a benefit called the farm effect. In rare cases, some Amish in Indiana carry a genetic mutation that slows aging and reduces disease risk, highlighting how their traditional lifestyle can lead to real health advantages. Unlike the Amish, who are often cautious or skeptical about modern medicine, the Mennonites fully embrace hospitals, doctors, and all forms of professional healthcare. In fact, many Mennonites not only rely on medical services, but actively participate in them, serving as doctors, nurses, counselors, and administrators. Their deep support for both physical and mental health care is not a recent development. It has strong roots in their Christian values and unique historical experiences, particularly during the 1800s and after World War II. During World War II, more than 1,000 Mennonites chose to serve their country in non-violent roles through the civilian public service, rather than enlist in the military. Many were assigned to work in psychiatric hospitals, facilities that were, at the time, overcrowded, understaffed, and poorly managed. The harsh and often inhumane conditions they witnessed deeply moved these young Mennonite volunteers. They saw patients neglected and mistreated, which sparked a moral and spiritual awakening within the Mennonite community. This experience galvanized many Mennonites to dedicate their lives to improving mental health care. After the war, Mennonite churches began to build their own mental health institutions, faith-based yet professional centers that could provide dignified care in a Christian environment. Notable examples include Philhaven in Pennsylvania, Brook Lane in Maryland, and Kingsview Homes in California. The construction of Kingsview Homes, for example, was a powerful display of faith in action. It was built through the financial support and volunteer labor of Mennonite Brethren congregations. Committees were formed to oversee everything from architectural plans to fundraising efforts. The mission was clear: to create a place where people suffering from mental illness could receive treatment that honored both their medical needs and spiritual well-being. Prominent Mennonite leaders like Arthur Jost advocated for this cause passionately. He and others believed that treating mental illness was not just a medical task, it was a social and religious duty. They argued that psychiatric care, prayer, and community support could and should coexist. Mental illness, in their view, deserved attention and healing just as much as any physical disease. As Mennonite-founded health institutions grew, they had to meet state and federal healthcare standards. Many evolved into more secular facilities to remain eligible for public funding and to serve diverse populations. For example, Kingsview eventually became part of a wider network of California mental health services, treating patients from multiple counties and working within public health systems. While overt religious symbols and language were reduced in daily operations, these institutions remained anchored in Mennonite values. They continued to provide pastoral care and spiritual support to patients who desired it. Importantly, Mennonite health workers never used hospitals as a platform for religious conversion. Healing was seen as a humble act of service, not a chance to preach. Today, Mennonite healthcare organizations continue to lead with compassion and excellence. The MHS Alliance, a network of Mennonite-affiliated hospitals and service programs, ensures that care remains accessible even when profits are low. Their philosophy is simple yet powerful. When it comes to helping others, walking away is not an option. In this way, Mennonites have not only accepted modern hospitals, they've helped build and improve them. Through faith, service, and professional dedication, they've reshaped the landscape of healthcare in the US and beyond. That's a wrap on our video. The Amish and Mennonites follow different healthcare paths, one rooted in natural remedies and mutual aid, the other in modern medicine and professional care. Yet both are guided by deep faith, tradition, and community values. Their choices show that healing can come through simplicity or science, shaped by generations of belief and experience. Which path do you think offers a better balance between faith and modern care, and why? Let us know in the comments. If you found the video informative, be sure to like, share, and subscribe for more stories on faith, tradition, and how communities care.